This lecture outlines the ACLS primary assessment using the ABCDE method. The goal is to provide healthcare providers with a structured approach to immediate patient evaluation and management. Each step in this process ensures that critical actions are performed in a logical sequence to maximize patient outcomes. Airway. Maintaining an open airway is essential for unconscious patients. Techniques such as the head tilt-chin lift or the use of basic airway adjuncts like oropharyngeal or nasopharyngeal airways are often sufficient. In cases where these methods are inadequate, advanced airway devices may be required. Examples include endotracheal tubes, esophageal tracheal tubes, laryngeal tubes, or laryngeal masks. The decision to place an advanced airway must balance the benefits against the potential interruption of chest compressions. If bag mask ventilation is effective, delaying advanced airway insertion until there is no response to initial resuscitation or until return of spontaneous circulation occurs is reasonable. Certain advanced airway devices, such as laryngeal mask airways, laryngeal tubes, or supraglottic airway devices, can be placed during ongoing chest compressions. After placement, confirm proper positioning using physical examination or quantitative waveform capnography readings. Following intubation, integrate cardiopulmonary resuscitation properly with ventilations to optimize pulse pressures and oxygenation. Secure the airway tube in place using an appropriate device. Continuous monitoring of airway placement is necessary, and quantitative waveform capnography should be used throughout the process. B. Breathing. Assessing the adequacy of ventilations and oxygenation is the next step. For patients in cardiac arrest, administer 100% oxygen. For other patients, adjust oxygen administration to achieve an oxygen saturation of 94% or greater, as measured by pulse oximetry. Monitoring tools such as quantitative waveform capnography and oxyhemoglobin saturation provide valuable information. While chest rise and fall indicate breath compliance, quantitative waveform capnography helps evaluate the effectiveness of cardiopulmonary resuscitation and rescue breaths in oxygenating the patient. If the partial pressure of end-tidal carbon dioxide is less than 10 millimeters of mercury, consider improving the quality of cardiopulmonary resuscitation. Similarly, if intraarterial diastolic pressure is less than 20 millimeters of mercury, reassess compression depth, rate, and hand placement to enhance the effectiveness of resuscitation efforts. C. Circulation. Attach a monitor and defibrillator to identify arrhythmias or cardiac arrest rhythms. These rhythms may include ventricular fibrillation, pulseless ventricular tachycardia, asystole, or pulseless electrical activity. Provide defibrillation or cardioversion as needed. Obtain intravenous or intraosseous access to deliver fluids and medications. Administer appropriate drugs to manage rhythm and blood pressure. Intravenous or intraosseous fluids may also be required depending on the clinical scenario. D. Disability. Evaluating neurologic function is an important component of the assessment. Check for pupil dilation, which may indicate brain death or viability. Use the Glasgow Coma Scale (GCS) score to determine the patient's levels of consciousness. E. Exposure. Remove the patient's clothing to perform a thorough physical examination. Look for obvious signs of trauma, bleeding, burns, unusual markings, or medical alert bracelets. Ensure the patient's privacy and warmth while conducting the examination. Subsequent assessment. Later in the assessment process, check glucose levels and body temperature. Assess and correct perfusion if possible. The primary assessment involves continuous evaluation and action until the patient is transferred to the next level of care. For unconscious patients in full arrest, whether cardiac or respiratory, this assessment occurs after basic life support measures. For conscious patients requiring advanced care, the primary assessment is conducted first. Real advanced cardiovascular life support scenarios often involve simultaneous actions by a high-performance team. Assess the patient and then perform the appropriate action according to the latest guidelines. Conclusion. The systematic approach outlined in this lecture ensures that healthcare providers can efficiently and effectively manage critically ill patients. By following the ABCDE method, healthcare providers can prioritize interventions and improve outcomes. Continuous practice and adherence to evidence-based guidelines are key to success in emergency care.
Thank you for watching. Please subscribe to our channel by clicking the subscription button. If you have any questions, feel free to leave a comment below in the comments section.